Hi, I'm Andy Furman, Managing Director of Benefit Advisors Group, and today we're going to break down Medicare into clear, easy to understand terms. Medicare can seem complex at first, but by the end of this video, you'll have a solid grasp of its parts, coverage options, and what steps you need to take to enroll. We will first talk about when you sign up, what the enrollment periods are, and how you can sign up for Medicare Parts A and B. For many, Medicare is a stressful topic. As we approach our 65th birthday, we are overwhelmed with information and marketing from the insurance companies. If we break Medicare down into its simplest form, it's actually pretty simple. What makes Medicare difficult is the amount of information and number of plans available to you. It's this information overload that makes Medicare stressful and overwhelming. Our minds just simply shut down. During this video, we will discuss what original Medicare covers and does not cover. We will preview the current stages of prescription drug coverage and will note some changes for the upcoming 2025 plan year. As we review the gaps in Medicare, we will highlight the two options you have to fill in those gaps and protect your financial well-being. What if you're still working past 65? Do you have to enroll in Medicare? Will you have a late enrollment penalty if you delay enrollment? We'll cover that as well. And lastly, we will provide you with some tips on why you might choose one option versus another, when you might stay on your employer plan, and when you might choose Medicare. First things first, what is Medicare? Simply put, Medicare is a federal health insurance program primarily for people aged 65 and older. It also covers certain younger individuals with disabilities and those with end-stage renal failure. Now, let's talk about when and how to enroll in Medicare. The initial enrollment typically begins 3 months before your 65th birthday and extends for 7 months. 3 months before your birthday month, and 3 months following your birthday month. Missing your initial enrollment window could result in penalties, so it is crucial to know your deadlines. However, if you are still working, you may not have to enroll in Medicare. Generally speaking, if your employer group health plan has 20 or more employees enrolled, then Medicare will consider that coverage as creditable. And if you have creditable coverage, you may delay your enrollment in both Part A and Part B without a late enrollment penalty. If your group health plan has fewer than 20 employees, then Medicare may not consider that coverage creditable, and you should consider enrolling in Medicare. If you miss your initial enrollment period, there is a general enrollment period every year from January 1st through March 31st for you to enroll in Parts A and B. And you may be eligible for a special enrollment period at various points. For example, if you are losing employer group coverage, that loss of coverage will create a special enrollment period for you to enroll in A and B. And if you had creditable coverage, then a late enrollment penalty will not apply. Lastly, once you are on Medicare, you will have an annual enrollment period annually from October 15th through December 7th. This is an opportunity to review your coverage and make any changes for the following year. It is especially important to review your prescription drug coverage annually, as the insurance company's plan may change and your prescriptions may change. If you are already collecting Social Security, your enrollment in Medicare will be automatic as you approach your 65th birthday. If you are not collecting Social Security, you can either call Social Security and set up an appointment, or you can log into your online Social Security account and apply for Medicare Part A and B that way. By far, the most challenging part of enrolling online will be signing into your account. You'll need your email and your cell phone, and if you've never created your online Social Security account, Medicare or Social Security may send you a verification letter in the mail, so don't delay. There are several parts to Medicare, each covering different aspects. We've all heard the ABCDs of Medicare. Let's break them down. Part A and Part B is known as Original Medicare. For most, Part A will be provided at no cost. There is a monthly premium for Part B, and that premium will be based off of your income reported 2 years prior. Now, if you have higher income, you may pay what's called an income-related monthly adjustment amount. And if you have a life-changing event that lowers your income in the current year, you may appeal that IRMA. Medicare Part A covers hospital stays, skilled nursing, and facility coverage. Now, what's important to know about Part A is there is a deductible per occurrence. Part B covers things like doctor's appointments, outpatient care, lab work, and durable medical equipment. Now, Part B has an annual deductible. What is really important to know about Part B is that it only covers 80%. You still have to pay 20% coinsurance. So for example, if you go to the doctor and let's say you've already met your annual deductible, you go to the doctor and the doctor's bill is $1,000. Medicare is going to pay the doctor $800, and the doctor is going to send you a bill for the remaining $200. There is no annual out-of-pocket maximum, so that 20% can be as high as your medical needs are in any given year. Now let's take a step back and review what we've discussed so far. Part A covers hospitalizations. There is a deductible per occurrence. Part A is free for most people. Part B covers things like doctor's appointments, lab work, and durable medical equipment. There is a monthly premium for Part B, which is based off of your income reported 2 years prior. What's really important to know about Part B is that you're on the hook for 20% after you meet your annual deductible. In essence, that's all original Medicare is. This is why Medicare is the intersection of your health coverage and financial wellness. If all you have is Medicare Parts A and B, your costs could be unlimited. What you don't get from A and B is dental, vision, prescription drug coverage, and of course, there is no help for long-term care under Medicare. Now, there are two ways to fill in the gaps for what original Medicare doesn't cover. Before we talk about your two options for filling in the gaps, let's first talk about prescription drug coverage. Prescription drug plans currently have 4 stages. The deductible stage, which if the drug has a deductible, you have to meet that deductible before insurance covers it. Once the deductible has been satisfied, you enter what is known as the initial coverage stage. Here you may have a copay or coinsurance for your prescriptions. Now, if you and the insurance company pay a combined $5,030 for your prescriptions, you enter what is known as the coverage gap or donut hole. Once in the donut hole, you need to pay 25% of the retail cost of your prescriptions. And you continue paying 25% until you and the insurance company pay a combined $8,000. Once you hit that $8,000 mark, you no longer have a copay or coinsurance for your prescriptions. Now, these stages are going away starting in 2025. In 2025, there'll be a $2,000 max out-of-pocket introduced for prescription drug plans. So the coverage gap or donut hole is effective going away. What is important to know about prescription drug plans is that each insurance company has what is called a formulary. That is a list of prescriptions they cover. And each formulary is divided into tiers, usually 6 tiers. And each insurance company decides for themselves what prescriptions will be covered and which tier they're in. For this reason, it is important to review your prescription drug coverage and review your monthly premium plus your anticipated annualized copays. What is a good prescription drug plan for your spouse or friend may not be the most appropriate prescription drug plan for you. That is because you're each on different prescriptions. You need to analyze your prescriptions, what the monthly premium and annualized estimated copays are. And just like your prescriptions may change, the insurance company may change their list of covered prescriptions. For that reason, it is essential for you to review your prescription drug coverage annually and make any changes during the annual enrollment period, October 15th through December 7th. Let's review briefly what we've discussed so far. Part A covers hospitalizations. There is a deductible per occurrence. Part B covers doctor's appointments, lab work, medical equipment. There is an annual deductible for Part B, and Part B only covers 20%. The first option to get coverage for what Medicare doesn't cover is a supplement plan, otherwise known as a Medigap plan. The second option is called a Medicare Advantage plan. This is what is known as Part C. Let's break each option down and then review when you might choose one over the other. Now, Medicare Supplement Plans, also known as a Medigap plan, is sold by a private insurance company. These plans help fill in the gaps in original Medicare, Parts A and B. Depending on which plan you enroll in, the plan may cover the Part A deductible as well as the Part B 20% coinsurance. With a supplement plan, you can see any doctor, any facility in the country that accepts Medicare. You no longer need to consider doctor networks. Each plan in the same category provides the same coverage regardless of who the insurance company is. So a Plan F, a Plan G, a Plan N provides the same coverage regardless of which insurance company you have. The only difference is who is the insurance company and how much are you paying. Now, in some states, for example, Massachusetts, supplement plans are different. In Massachusetts, there are only 3 supplement plans: Core, Plan 1, and Supplement Plan 1A. The Core plan covers the Part B 20%. You still need the Part A deductible. Plan 1 is only available for those who turned 65 prior to January 2020. Plan 1A covers both the Part A deductible and the Part B 20%. And again, it doesn't matter which insurance company you have. Also in Massachusetts, the supplement plans are what we call guaranteed issue. So no matter when you apply for it, you are guaranteed to be issued the policy. Doesn't matter what your health situation is. In many states, if you don't apply for a supplement plan when you first have Part B, you may have to go through medical underwriting, and the premium you pay for that may be higher based off of your past conditions. In Massachusetts, there will never be medical underwriting, and your premium will not be based off of your past medical history. Now, if you choose supplement plan option 1, you still need to add a standalone prescription drug plan, a dental plan, and a vision plan if you want it. So you may be paying multiple premiums. You'll be paying your Part B premium to Social Security, your supplement plan premium to an insurance company, your Part D prescription drug plan premium, perhaps to another insurance company, your premium for a dental plan, and your premium for a vision plan. The nice thing about option 1 is that you have freedom and flexibility to see any doctor, any facility in the country that accepts Medicare. And you will have comfort in knowing that after you make that monthly premium payment, your out-of-pocket expense will be lower as the supplemental plan covers deductibles and coinsurance. The downside is you'll be making up to 5 different payments per month, and you're paying a set amount even if you never use the plan. Now let's talk about option 2. The other way you can fill in the gaps is with a Medicare Advantage plan, also known as Part C. Under a Medicare Advantage plan, you're actually moving off of original Medicare and onto private insurance, similar to the coverage you've had during your working years. Now, this is where the overwhelming marketing is coming from. You may have heard the TV commercials and radio ads. They go something like this: no monthly premium, no copay for your PCP, no deductible, free dental, free vision, free hearing, free transportation, free meals, free gym membership. That commercial leads you to believe that everything is free. Let's talk about this for a moment. First, how is it possible for an insurance company to provide you with insurance without a monthly premium? Sounds too good to be true, right? Here's how it works, and I'm going to make up numbers for the sake of illustration. Basically, what happens is the Medicare Advantage insurance company goes to the federal government. They go to Medicare and they say, hey, Medicare, based off of our calculations, we estimate it's costing you, the federal government, $5,000 to provide original Medicare Parts A and B to your beneficiaries. We believe we can manage their care for $3,000. So the government says, great. If someone enrolls in your Advantage plan, we will pay you the $3,000. The government is happy because they're saving $2,000 in no longer managing your medical claims. The insurance company is happy because they are getting paid. So it's not that the Advantage plan has no monthly premium, but rather you're using the federal government as a pass-through to pay it on your behalf. So the next question is, how can a private insurance company manage your coverage for a lower amount than the federal government? They're doing so through 2 primary methods. First, like your group health insurance plan, the Medicare Advantage company goes out to all the doctors and hospitals and provides them with a negotiated set of reimbursement rates for every service a doctor or hospital can provide you. Some doctors agree to that reimbursement rates, others do not, and that's why we have networks. For this reason, we have HMO plans and PPO plans. Under an HMO plan, you have to use an in-network doctor. Under a PPO plan, you can see an out-of-network doctor, however, you may pay more. So the first way an insurance company manages your care for less than the federal government is through a set of negotiated rates. The second way the Advantage company manages your care for less is through a series of copays. Now, while it may be true in those commercials that there's no PCP copay or no deductible, there likely is a copay for every other service, such as a specialist visit, an x-ray, an ER visit, or a hospitalization. And just like your group health insurance plan, there's a maximum out-of-pocket or a stop loss. If you hit a certain dollar amount, the Medicare Advantage company will now start covering everything at 100%. Many Medicare Advantage plans also include prescription drug coverage and ancillary benefits. So now the question is, which way do you go? If you have incredible employer coverage, do you stay on that or do you go on Medicare? If you're on Medicare, do you enroll in option 1, a supplement plan with a standalone prescription drug plan, or do you go with option 2, a Medicare Advantage plan? Let's first take a look at the considerations for when your employer plan is a suitable option. If you have higher income, if your Part B premium plus your income-related monthly adjustment amount is such that your employer plan is more affordable, well then that's the consideration. The second consideration is if you have a younger spouse or dependents on your group health insurance plan. If you drop off your employer plan, they're likely going to lose their coverage, and you now need to consider what their coverage costs and what their benefits are. In the third consideration for your employer plan, if you are on brand name prescriptions, that may be more affordable under the group plan. Keep in mind, retiree coverage in COBRA is not considered creditable by Medicare. So if you're on a retiree plan or COBRA, when you go to enroll in Medicare later in life, you may pay a late enrollment penalty. Okay, so you're enrolled in Medicare now. You need to decide whether option one, a supplement plan with standalone prescription drug coverage, is more appropriate for you, or if option two, a Medicare Advantage plan, suits your needs. Option one is a good choice for those who want to budget their medical cost. You make a monthly payment for lower out-of-pocket expenses when you go to the doctor or hospital. This is helpful for those that have a chronic illness, critical injury, if you are predisposed to routine and frequent care and/or routine and frequent hospitalizations. If we know that you'll be paying higher copays under an Advantage plan, then a supplement plan may be more affordable and will smooth out the cost of care throughout the year via monthly premium payments. Since you can see any doctor in any facility in the country under a supplement plan, this option often works well for those who live in multiple parts of the country throughout the year, and you have providers in each location. Now, when is Medicare Advantage a good option for you? Someone who wants low or no monthly plan premiums. Now, even under a Medicare Advantage plan, you still need to pay your Part B premium and any income-related monthly adjustment. But other than that, there's typically no additional monthly premiums. Those who are in relatively good health and do not use their health services regularly may find an Advantage plan as a suitable option. If you like the network of doctors, your doctor is in network, you understand the copays, and you want the extra ancillary benefits, an Advantage plan may be a good option. The plan looks, works, and feels just like your current group health insurance. Thank you for joining us today for Medicare Basics. We hope this video has provided you with a solid foundation to navigate Medicare confidently. Let's summarize what we talked about. Medicare Part A covers hospitalizations. There is a deductible per occurrence. Medicare Part B covers things like doctor's appointments, lab work, and durable medical equipment. But Part B only pays 80% of the bill. You are on the hook for the other 20%. It is important to review your plans annually, especially your prescription drug coverage, as the insurance company may change their list of covered prescriptions and your prescriptions may change. We talked about the two options. First, a supplement plan with a standalone prescription drug plan and a separate dental and vision plan if needed. And then the second option is the Medicare Advantage plan. For more information, visit benefitadvisorsgrp.com or speak with a licensed Medicare advisor by calling 978-494-6611. Medicare is the intersection of your health coverage and financial wellness. It's your health, it's your wealth. Worry less, heal more. Until next time, stay informed and stay healthy.